Welcome back to part 2 of our Menopause Journey series. In part 1, we discussed what perimenopause is, what menopause is, and also what postmenopause is. And also we touched on some of the symptoms that people will experience during these different stages of this menopause journey. Today we're going to try and find some solutions to some of these very debilitating symptoms. You know, when you get a hot flash, you feel like, okay, what is this? But it's usually really just a minute or so, and then you are back to normal.
So let's start with a hot flush.
But maybe, Trudy, to your point, because it's so important for a person to say, okay, this is what I'm experiencing. Let me go and get a proper assessment.
Yes.
You know, I think that's important. Yeah.
You need your blood pressure check, because that's when your blood pressure changes. You need your cholesterol check, because in women, as we transition into the menopause, our cholesterol often goes up. Estrogen protects our heart from cholesterol. So that's why it's very important to have a health check to measure your circumference, your waist circumference. You know, so important, very, very important. And like we said, to exclude other causes of the symptoms that you're having. We know that you should exercise. Exercise improves flushing. We know sleep is important. Sleep hygiene. You know, not your cell phone scrolling at night with the blue lights, etc., in the background. So sleep is important. We know exercise is important. We know food is important. We've spoken before in the first series about how alcohol, spicy food, yellow cheeses, etc., can make you flush. So if you really control your diet and have a healthy diet, a Mediterranean type of diet, often your hot flushes decrease. Wear layered clothing, cotton clothing, as opposed to nylon and non-breathable clothing. That will help your flushing. And also at night when you sleep. You know, silk sheets are no good for a menopausal woman. You need to have nice, thin cotton sheets. So those are the first steps that you can take. And obviously, lifestyle modification is number one. But before you enter the hormonal space or the non-hormonal space, is not everybody can take hormones. Not everybody is able to take hormones.
It's so important for women to be educated about what is available to them, and also understanding the science behind, hormone replacement therapy, because I think right now we're moving to like everyone needs HRT, but I think what you're saying is that it's important for that initial assessment and then to understand what symptoms you're trying to treat and the benefits of then using whichever treatment modality that you have chosen. And the benefits of HRT, which is the hormone replacement therapy, is that you do get the replacement of the hormones that are deficient.
So, now when you read, you might, instead of reading HRT, it's now MHT. So I want us to shift our minds to menopausal hormone treatment.
Hormonal treatment. Okay.
Yeah. Okay. And because there's there's important things about it.
Oh, people, they throw HRT. Now you change into MHT, but we'll get used to MHT as well. But my worry is that so there are women who are gonna go and get estrogen replacement, and they still have their uteri in place. So can we speak about that? Because we want people to manage their symptoms, but it must be done in a safe way.
So when we were made as women, we were given two hormones, estrogen and progesterone. So the estrogen is the thing that keeps our bones strong, stops us from flushing, stops us from night sweating, protects our heart. And the progesterone was given to us to protect our uterus, to protect our endometrium from developing a cancer, and to protect it from getting thicker and thicker and thicker, because that's what estrogen does to your lining, and progesterone makes it thinner. So when you have a uterus, you have to utilize both estrogen and progesterone. Otherwise, you'll get a uterine cancer. In fact, progesterone has very little role in terms of flushing, etc. It helps you sleep at night, definitely. But that's a natural progesterone, helps you sleep at night. The other thing that is very important for us to discuss is I don't know if people realize that natural progesterone through the skin does not work well on the uterus. So you cannot use a cream, a progesterone cream. It will not protect your uterus at all. And you have to
So you have to check.
you have to take it orally. There are patches that contain a registered license patches that contain a progestogen. It's got a different name because it's synthetic and it's especially designed to go through the skin, but a natural progesterone doesn't. And so it's important for every woman with a uterus to have both estrogen and progesterone, and the proper progesterone that's going to protect their lining.
So the women out there who are saying, I'm not coping, but I really don't necessarily want to take menopause hormonal treatment.
Okay.
What do you say to them, Judy?
So it's a tough one because we also know that a lot of over-the-counter medications have what we call a large placebo effect. We know things like cognitive behavioral therapy has actually been shown to be effective in managing symptoms. Do you know that? That if you go for therapy, cognitive behavioral therapy, it does. So, and we also have to be careful because some of these things might be toxic. Many things like black cohosh, etc., can be liver toxic, particularly in women who have liver disease. So it's quite complex, isn't it? There are other.
Judy, if I go to the pharmacy, it's a whole aisle full of natural products for menopause, the phytoestrogens, the plant estrogens.
And what does that tell you? When there are many, many different products for a thing, it means nothing really works. It's the truth. It is the absolute truth. We'll try this, we try that, we try this. What I explain to patients is serotonin, the happy stuff in your brain, affected by estrogen. So that's why we know certain drugs called NNSRI, so non-serotonin, long words, reuptake inhibitors, they actually, while they might be an antidepressant, they actually decrease flushing. And so we have other drugs that we can use, for instance, in women that cannot take hormone treatment. And I think what is so exciting now is we have a new drug that's come. It's called a candineuron inhibitor. Long words as well. This drug acts specifically in the brain on the flushing center. And this drug will become important in managing hot flushes because it's not a hormone. So we can use it, for instance, in breast cancer survivors, in women who don't want or can't use hormone treatment, but who are flushing terribly. And that those drugs will soon come to South Africa as well and be available to us. So there are alternatives that can be tried.
That's awesome. That's awesome. Let's help people save their marriages now, Trudy. So the flush is fine now. I'm okay. But there are other aspects of my life that I would like you to help me with.
I think the most important one is your vagina. We have to cut the vagina, and we mustn't shy from the word vagina. We did
the big V.
The big V. We did a fantastic study in South Africa. We looked at women across population groups, both ethnic and financial population groups, and the number of women that suffer from a dry vagina or uncomfortable sexual intercourse. When it's uncomfortable, you're not going to want to have intercourse.
Yeah.
Your Body naturally says no, thank you, and that's called
And it's never meant to be dry.
And it's never meant to be dry. Many women might, that's a separate discussion, but it's not.
That's another discussion. It's not meant to be dry.
It is not meant to be dry. But genitourinary syndrome of women, a dry vagina, gets worse and worse and worse as we progress through our menopause. And that's why, as you get older, it becomes thinner, intercourse becomes more uncomfortable. You don't want to have intimacy, but incontinence, bladder infections, a burning vagina, an itchy vagina. Not every itch is a candidate. And when we become menopausal, it's usually because of a lack of estrogen in our vagina. And we know, ladies, and gentlemen, we have to educate our male folk is that the use of vaginal estrogen is safe. It is incredibly safe. In fact, all of those medications are what we call Schedule 2 or over-the-counter medications. So you can save the vagina. You can save the incontinence.
Save the vagina.
You can save the painful sexual intercourse by using vaginal estrogen only. And sometimes that's all women need, is they need vaginal estrogen. And there are lots of fantastic products that you can use.
But now, Trudy, there will be someone watching and saying, I don't like all these hormonal things. I'm scared because I've got a family history of cancer. I worry about anything hormonal because I hear hormones can actually, help cancers grow. So who cannot take hormonal treatment, whether it's vaginal or, the systemic menopause hormonal treatment?
So anybody with undiagnosed vaginal bleeding. So in other words, if you're having heavy bleeding, a postmenopausal bleed, you need to be seen. You can't just take hormones.
Wow. So thank you so very much. I think we've touched on quite a lot. In our first part, we spoke about even some of the other aspects of lifestyle. So thank you so, so much, Trudy. Just on an aside, from a discovery point of view, because like we said, you need to be discussing all these with your clinician. From a discovery point of view, we have partnered with Stella. So we've got an app that our Discovery Health Medical Scheme members can access that supports women. It is evidence-based, Trudy, but it has got nothing to do with Trudy, but it is evidence-based. So it looks at the literature that's available to say, what are those interventions that could work? And then it facilitates the engagement, and it helps the women when they're not in the doctor's room to also still understand what is happening to their bodies. So we're quite excited because this really empowers women to have information that previously they didn't have easy access to. So thank you so much once again, Trudy. And we really hope that this information will have a positive impact in someone's life, and it will definitely make it much, much easier. Thank you so much. Goodbye for now.